M1056, reason pneumococcal vaccine not received. If the patient has never received the pneumococcal vaccine, state the reason. This indicator is collected at transfer to an inpatient facility and again at discharge from agency OASIS. The clinician should consider patient-caregiver interviews, review of the clinical record, and information received from the physician. The time measure in which this indicator is collected is transfer to an inpatient facility and discharge from agency OASIS. Medicare's intent for this indicator is to explain why the patient has never received a pneumonia vaccine. 1 is selected if the patient refused the vaccine. Response 2 is selected if the patient has medical contraindications for taking the vaccine, such as chemotherapy or radiation or a bone marrow transplant. Response 3 is selected if age condition guidelines indicate that the pneumonia vaccine is not indicated. Response 4 is selected if there is a reason other than 1 through 3. It is important to know the patient's immunization status early in the episode, as this indicator is collected only at transfer or discharge, and there will be no time to assist the patient in getting a pneumonia vaccine when the indicator is collected. It has also been noted to improve care if the agency has a standing order for pneumonia and influenza signed by the medical director in the agency's policy and procedure manual. Medicare does cover the cost of a pneumonia vaccine and a booster every 5 years. The pneumonia vaccine is also covered by most Medicare Advantage plans, so money should not be the issue in ensuring that the patient receives the pneumonia vaccine. This indicator is one of the measures collected in the value-based purchasing model. To improve this indicator, the patient needs to receive a pneumonia vaccine unless it is contraindicated. It may be helpful to establish a tracking system to identify the immunization status of each patient and work to ensure that all patients are immunized. If your software vendor provides a report to track immunization status of each patient, share this report with case managers and team leaders so that each patient is vaccinated if applicable.